sounds like we might need to change the name, is what I'm getting from there. Repeat after me, Ieso. Perfect, thank you very much. So what I wanted to do today was give you a bit of a case study for some of the work we've been doing over the last few years. Ieso, we operate in cognitive behaviour therapy delivered online through written therapy. So the patient meets one-to-one with the therapist in a kind of a virtual chat platform where they have typed conversation between each other. And what that allows us to do is, for the first time, is to see the full transcript of the conversation between a patient and the therapist outside of the therapy room, which is really interesting. So one of the kind of the key things that we see is that by having your therapy not face-to-face with your therapist, there's this online disinhibition effect, which means that you can engage with therapy in a much quicker way. So we already see in the therapy room that people are opening up much sooner than they might do in face-to-face. So that often means a reduction in the number of sessions to recovery and some efficiencies that come from doing that. And some people prefer using online to face-to-face. So we've treated around over 40,000 people since Ieso's been going, and about 20,000 of those have been this year, which is really down to the transformation that we're seeing in IAP services, improving access to psychological therapy services, really embracing digital. Most of our sessions tend to take place outside of the standard operating hours, so it adds in additional capacity into the service. So there's no limit to the number of sessions that a therapist and a patient can have. Ultimately, we're working to providing an evidence-based treatment to get that patient better as quickly as possible. So with Sussex, about 4 years ago, the issues that they were facing is they had a population of people, the number of patients coming forward for treatment was going up, and yet they had only a certain number of CBT therapists that were able to deliver treatment. So whilst they were getting excellent recovery, and they were certainly in the top for the country, and they were meeting their access rates, that constant flow of patients was putting a strain on the service. So that was leading to an increase in waiting times on their CBT treatment list. So that was getting up to around the 300 mark. So they sat down and had a look at what their kind of maximum number of attended slots were to try and come up with a solution. So with an average of around 11.8 sessions that they were delivering in treatment, but only moving just over 30 patients through per month. And that was what was creating the backlog, is that there were more that were coming in than they were able to treat over that period of time. So that was adding, at the beginning, around 40 to their wait list, and they weren't able to clear it. So had they stopped that moment in time and treated those patients, it would have taken them 9 months to clear the backlog. But obviously, you can't stop and turn everything off. And that was very bad for patients because it was increasing the waiting times, and it was also incredibly bad for the therapists and their morale. That was having a real impact on that. So they looked at what the various solutions that might be available. So you could potentially reduce the number of sessions that you were delivering per patient. So instead of the 11.8, you take that down and you really squeeze it. But unfortunately, that means that you don't provide an effective therapy dose, and that has an impact on your recovery. Or you potentially look at increasing the number of treatment options that were available, but you still need that to be clinically effective, and you need it to be economical. So the third option that they looked at was about offering overtime and offering evening and weekend appointments to their existing workforce. The trouble is if you're making your team work harder and longer, that leads to burnout over a period of time. So there was some resistance to looking at alternative modalities, and one of them being that written CBT doesn't seem natural to services that are used to seeing patients face-to-face or talking on the telephone. But once we'd sent in our clinical mentor team and really sat down and explained how the service works and the benefits of it, they began to realize that it was a really feasible solution for them. So the solution at the beginning was the solution to start with wasn't to squeeze the tube at both ends, it was to squeeze it at one end only. And that was to attack the wait list. So we contacted everybody on the wait list and had a pretty poor uptake, around 15%. Now, the reason is that once people have been on a wait list and they're expecting one thing, it's very difficult to then offer them an alternative solution. So that that had an impact, but the wait list was creeping up. So phase 2 of that project, and we were learning with Sussex at the same time, was to say, okay, if we target the wait list and at the same time from assessment take patients off into treatment, then that will add capacity and clear the backlog. So generally speaking, in a graph, this is what happened. So the waiting list was at its highest point, and there's a transition period that phased approach of tackling the wait list and providing treatment from the front door at assessment increased the capacity in the service so that the existing workforce were able to concentrate on the really more complicated cases or those that really wanted face-to-face treatment. And we were able to help them with their capacity for people that were choosing digital as an option, with the added benefit with our service of being into treatment within 5 to 10 days maximum. So over 6 months of that second part of the treatment the phase program, the backlog had dropped entirely. So we're looking at around this 11-month point. This case study, incidentally, it finishes about 2 years ago. So we're now continuing to work with Sussex in exactly the same way, and that's grown. Our relationship and our partnership with them has grown over that period of time. So just to recap on what that waitlist program can look like, it's about suggesting a digital intervention to people. There's no waiting list for our service, as we have around over 600 PWPs and CBT therapists, fluctuating capacity at different times across the country because our service operates all over the place at any time. But one of the really important things that we discovered was that providing the option for patients at assessment at the front door and giving them the choice of accessing digital meant that they could choose appointments outside of the working day, or they might have had access or mobility issues. And Ieso became a preferred choice for a large number of people, or a certain number of people that were coming through that assessment pathway. And all of the data and all of the measures that we collect are standard IAP measures, and that's, detail. So, as I mentioned at the beginning, one of the things that we have is this collection of the data, which is the transcript between the patient and the therapist. And what that's allowing us to do is analyze the measurement scores, the outcomes, looking at what's happening in therapy, and to start to analyze for what works in therapy. What's the best way of treating a patient with a particular clinical diagnosis, using which NICE recommended evidence-based approach. And at the same time, we can monitor that the therapists are adhering to the correct protocols. So all of that allows us to make sure that what's going on between the patient and the therapist is the best that it can be in order to generate that patient's best outcome. Just to recap on us, we work in around 70 CCGs, available to about 12.5 million people. We've treated thousands of patients and collected a lot of data. We know what we're doing, and we're really happy to be working with lots of CCGs and mental health trusts across the UK. Probably no time for questions, I don't think. We're going to do that afterwards, but we've got a stand in the foyer, so if you grab your lunch and want a chair and a table, come and talk to us. Thank you.